Phlebotomy is a crucial part of healthcare, ensuring accurate blood collection for testing, diagnosis, and treatment. Although the role might seem straightforward, it requires a combination of technical expertise, patient care skills, and attention to detail. Employers hiring phlebotomists look for candidates who are not only proficient in drawing blood but also capable of maintaining a calm, professional demeanor in high-pressure situations. Beyond technical skills, phlebotomists interact directly with patients who may be anxious, nervous, or uncomfortable. Their role is essential in creating a positive patient experience while ensuring that each blood sample is collected safely and accurately. Interviews for phlebotomy positions focus on both clinical knowledge and interpersonal skills. In this video, we'll explore the most common phlebotomy interview questions, provide sample answers, and share tips that can help candidates leave a confident and professional impression. Common phlebotomy interview questions and answers. 1. Tell us a little about yourself. Interviewers want a brief overview that highlights your qualifications and motivation. Sample answer. I am a trained phlebotomist with hands-on experience in clinical and laboratory settings. I am dedicated to ensuring patient comfort while maintaining the highest standards of accuracy and safety. My goal is to contribute to healthcare teams by providing reliable blood samples and creating a reassuring experience for patients who may be anxious or nervous during the procedure. 2. What inspired you to pursue phlebotomy? This question explores your motivation and passion for the field. Sample answer. I chose phlebotomy because it allows me to combine technical skills with direct patient interaction. I enjoy helping people feel at ease during medical procedures, and I value the importance of providing accurate samples that support effective diagnosis and treatment. Being a part of this process gives me a sense of purpose and fulfillment. 3. How do you calm patients who are afraid of needles? Patient care is central to phlebotomy. Sample answer. When I encounter nervous patients, I focus on communication and reassurance. I explain the procedure step by step, answer any questions they may have, and use gentle, confident techniques to minimize discomfort. Small distractions, like light conversation, often help the patient relax while I complete the procedure efficiently. 4. Can you walk us through the steps of a proper blood draw? Technical proficiency is critical. Sample answer. I begin by verifying the patient's identity and confirming the test requirements. I sanitize my hands, wear gloves, and prepare all equipment. After selecting a suitable vein, I clean the area with antiseptic, insert the needle at the correct angle, and collect the sample. Once the draw is complete, I remove the needle, apply pressure, label the sample immediately, and dispose of the sharps according to protocol. Finally, I document the procedure accurately in the patient record. 5. What strategies do you use to avoid labeling errors? Accuracy is crucial in every sample collection. Sample answer. I always label samples at the patient's side and double-check the patient's name, date of birth, and test order before moving on. I avoid distractions during labeling and stay organized, ensuring that each sample is accurately identified and ready for processing. This prevents errors and maintains the integrity of the testing process. 6. How do you manage difficult or uncooperative patients? Interpersonal skills are as important as technical skills. Sample answer. I remain calm and professional, listening carefully to the patient's concerns. I explain the procedure clearly and reassure them throughout. If the patient refuses or becomes combative, I follow the facility's protocols, such as notifying a nurse or supervisor, while ensuring safety for both the patient and myself. 7. What safety protocols do you follow during blood collection? Safety and infection control are top priorities. Sample answer. I strictly adhere to universal precautions, wearing gloves, using sterile equipment, and disposing of needles in puncture-resistant containers. I sanitize my hands before and after every procedure, clean work areas, and ensure all blood samples are handled according to infection control guidelines. Protecting patients and myself is always my first concern. 8. How do you handle high-pressure situations or heavy workloads? Phlebotomists often work in fast-paced environments. Sample answer. I stay organized, prioritize tasks, and maintain focus during busy periods. For example, during blood drives or emergency situations, I prepare equipment in advance and work efficiently without compromising patient care. Keeping a calm mindset helps me handle stress and complete procedures safely and accurately. 9. What do you do if you cannot find a vein? Problem solving is essential. Sample answer. If I cannot locate a vein immediately, I remain patient and reassure the patient. I may try techniques such as warming the arm, asking the patient to make a fist, or gently massaging the area. If unsuccessful, I follow protocol by seeking assistance from a colleague or supervisor to avoid multiple attempts and reduce discomfort. 10. Why should we hire you as a phlebotomist? This is your chance to summarize your strengths. Sample answer. You should hire me because I combine technical expertise with patient-focused care. I am confident in performing safe and efficient blood draws, maintaining accuracy, and following strict safety protocols. Additionally, my ability to communicate clearly and empathize with patients ensures a positive experience for both the individuals I serve and the healthcare team I support. Tips for excelling in a phlebotomy interview. Prepare by practicing answers to common questions and reviewing key procedures. Show empathy and explain how you ensure patient comfort. Emphasize your attention to detail, accuracy, and adherence to safety protocols. Provide examples from real experiences to demonstrate your ability to handle pressure, work efficiently, and maintain professionalism. Confidence, preparation, and clear communication make a strong impression on interviewers. Conclusion. Phlebotomy interviews are designed to evaluate both your technical skills and your ability to provide patient-centered care. Employers look for candidates who are precise, reliable, and professional while demonstrating empathy and clear communication. By preparing examples that highlight your technical competence and interpersonal skills, you can show that you are ready to handle the responsibilities of the role effectively. Success as a phlebotomist depends on more than just drawing blood correctly. It also requires making patients feel safe, maintaining accuracy, and following strict safety standards. Approaching your interview with confidence, preparation, and a genuine focus on patient care will help you stand out as a professional who can make a meaningful impact in healthcare.